Hi guys, so I'm just gonna do my quick postpartum assessment on mom. My name is Hensel. I'm a third year student nurse. So then I would just go through my scenario on how to assess mom with postpartum. So then I wash my hands. I've gathered all my equipment and I've come into the room. I've assessed the room for any safety hazards and as well the call bells in reach and making sure the emergency equipment's available. So that's good. I'm just going to introduce myself. So hi, my name is Hansel. I'm a third year student nurse. I'm going to be doing your care for the day and as well I'm going to be doing your assessment. What was your name?
Zeddy.
Hi Zeddy. So how are you feeling? So Zeddy usually may be postpartum. It's by patient scenario. Zeddy may be feeling tired, maybe not in the mood and or very happy, or as well as they could just be wanting some rest. So it's really important to know that during initial encounter and just assess and go through what you can do. So then I would just take my mom's vital signs. So then I would take temperature, pulse, I would take the blood pressure and as well the oxygen. And then I would move on and then do my chest. So quickly look at their chest. And then I would my basic head to toe, listen to the heart. Okay, and then I would listen to the lungs for any adventitious sounds, and making sure they're all symmetrical. And then I would then assess and do my abdomen. Then I would check the abdomen, and as well if there's any in and outs, and then as well as when's mom's last bowel movement, when's last urine output, last void, and then I would go move on and do my perineum checks, and then I would do my just general head to toe. Then I would just check at the legs. So once I've done that, then I would just assess mom. So then I'm just gonna go through for postpartum assessment is going through the bubbles. So I would ask mom to take a look at their breasts. It's per patient scenario, so then I would just look at the breasts. So then I'm just going to expose of it. If they're comfortable, then I'm going to take a look at it, making sure it's symmetrical. If it's the nipples are flat or inverted, or is there any signs of trauma to the breasts and nipples, such as cracking or like any blisters. And as well at this point, then I would ask mom, are you breastfeeding? Are you planning on breastfeeding? Or if they choose to do bottle feed, it is up to the parents, and we just do our best to educate and support them with their decision. So then I would move on and then go check on my uterus. So next step of bubbles. So I'd assess the uterus, my fundus, so the uterus. Then I would just slowly palpate. Just gonna feel this. So then starting from like the umbilical line, then I would just measure it. If it's like 1 under or 2 using my fingers. And then from there, I would just palpate my uterus, making sure it's firm. Any abnormals would be 2 centimeters above umbilical line, and as well if it's boggy. If it's boggy, what we can do is that we can massage the uterus until it's firm. Okay, so then making sure it's firm, so that's good. So moving on, then I would do my bladder and bowel assessment on the bubbles. So then I would just ask mom, when was the last time you had a bowel movement? Okay, so usually mom might not have a bowel movement after surgery. Usually it takes time for the body to process itself and heal after surgery. So normally it could be 2 to 4 days post-op. And that's why we also prescribe you a stool softener, which is ducosate sodium, and that will help you stimulate your bowels, and that will soften the stool as well. Then I would just check mom's, when was the last time you voided? Or gone to the bathroom?
No.
You haven't gone at all? Okay, so after surgery, normally they should be able to go like 2 hours after, and then after 2 hours. So then when you just go to the bathroom, if you do go, just let me know. We have this squirt bottle, which is like you just have warm water in it, lukewarm, and then you just squirt it into your area. So then it just cleanses the site and it cleans it without you having to it's a far reach down there. So yeah, it just cleans it and it prevents any signs of prevents you to have any infection, which we don't want you to get. Then there's no any foul smell or any discharge that's abnormal. So then I would like go on and move. Oh, sorry. So with the Foley catheter, if mom can't void, usually they have orders for in and out, because what happens that if the bladder is full, it's going to compete for space. So then what happens is that the uterus is going to be inverted, or it's going to be displaced from its site. And usually the uterus too, with abnormal findings, is that it could be like there's tissue fragments or any like clots that could make the uterus go invertedly from its supposedly site. So moving on, then I would just check mom's legs, Lutia. So then I would just assess mom's pad, make from small, medium, or moderate. Usually after post-op, they would have red rubra, which is a dark red output, and then it's 3 to 5 days, which is normal, and then it transitions on to like serosa, which is more like pink or brown, and then that's usually like 5 days to like 2 weeks, and then after that, maybe from like 5 to 2 weeks, like later on, it transitions into a more normal like creamy white vaginal discharge, which is the alba. So then after that, then I would just assess and measure, making sure there's no abnormal. If mom had, let's say, like a pad here for just an hour and then it's like super moderate, then that's indicative of like heavy bleeding. So we just want to make sure we assess that and making sure we're just taking a look at it and doing something if there was any abnormal. So then next, moving on, then I would just check the legs. So mom post-op are higher risk for DVT and possible forming of clots. So then we're just gonna check the legs, making sure there's no redness or any swelling. Okay, do you feel any pain at all to your legs? No. Okay, do you feel any calf pain upon doing this? Okay, then I would just make sure there's a perfusion, calf refill, all that. So yeah, that's it. And also, as well as next step in the bubbles is the emotions. So then I would just assess mom how they're doing subjectively, see how she is feeling, and if she has any support, maybe there's a family member at the bedside, also talk to them. And just know that sometimes it's normal to have mood swings like after birth, so like the baby blues versus postpartum. But if you do have these symptoms more than like, let's say 3 weeks after you've given birth, then it's important to seek help. So then I'm just moving on, and then I would just assess the last thing, which is stitches. So with C-section, or maybe there's a tear, or with forceps delivery, so I would just assess the site and do a wound assessment, and if there's any like abnormal, if there's any foul smell, any purulent drainage like green, or if there's any redness around the site, I would just assess that. Does mom have a hemorrhoid within the parent, like the area? And then as well as with the C-section is that mom will have a low transverse, so it's also important to check that. If there's any dressing or any drainage, such as a JP drain, it's important to assess that as well. Right, so I think we're all done. So then next I just move on, like if mom has pain, normally they would have any medications with the self-medication packs. This is ibuprofen and then Tylenol, and as well as there could be IV fluids running, so I would just check, assess mom's IV site, and as well as assess for allergies before giving any of those medications, and just provide as much teaching as possible. So then before I leave, then I would just ask mom, like, would you like me to get anything, or do you need anything in the meantime? Can I get you more of this, or some sort of little things just to help them feel comfortable. Okay. Do you have any questions for me?